These are Kenya's future doctors, marching on the streets to enforce what they term as their rights, branding placards led by what they say is a sense of aggravation at the hand they have been dealt by government. Amongst them are about 400 interns who are yet to be deployed into the system, who now face a new hurdle, one that has them irate. The Ministry of Medical Services has confirmed that it was planning to introduce a clause in the terms and services of the incoming medical services interns that will compel the new doctors to work for the government for a minimum of 3 years or have their licenses revoked. The doctors under the Kenya Medical Practitioners, Pharmacists and Dentists Union termed the move as, quote, retrogressive and ancient, end quote.
The union believes that no Kenyan deserves to be treated by a doctor who has been forced to work for government. We instead call on the Ministry of Medical Services to initiate immediate reforms to improve the welfare of doctors.
The government on its part argues that the doctors need to work in the public sector so as to address the shortage of doctors. But while acknowledging this fact, the union says there was need to address budgetary allocations to the health sector. The Abuja Declaration, which Kenya signed to in 2001, stipulates that the government should allocate 15% of their national budgets to health. In 2009-2010, Kenya allocated 7%, and in the year 2010-2011, the percentage reduced to 6.7%.
Kenya needs close to 38,000 doctors. The country currently has only 8,000 registered doctors. Out of these, only 3,000 are in public service, 4,000 are in private practice, and 1,000 have left the country.
The group led a procession to the ministry headquarters, where they presented a list of their grievances to ministry officials. They were addressed by the Permanent Secretary, Mary Ng'ethe.
The posting has already been done.
Oh, we are here.
No, let me finish. But there was only one problem, that the supplementary estimates, which includes your salaries and your allowances, had not been approved.
But they were not satisfied. Minutes later, they stormed the offices where their officials were in consultations with the ministry officials. It is a requirement that fresh graduates in the medical field undergo a 1-year paid internship in government-owned health facilities before they are absorbed in full-time employment. The government says that posting can only be done when a 750 million shilling supplementary budget is approved by Parliament. Parliament was on Wednesday adjourned for 2 weeks in a move that could delay the process.
After about 3 hours of waiting and consultations with the ministry officials, Kenya's doctors and future doctors leave, albeit with some grievances. For now, consultations continue, but it is evident that something needs to be done, and done quickly. Willis Oburu, Citizen Live at 9, Nairobi.